I want to take just a few minutes to talk a little bit about psychotropic medications. And within this category, we are talking about medications that help deal with mental disorders. And you need to have a good working knowledge then of what these medications are, their benefits, their side effects, and their risks. With each medication based on what it's designed to do, and there are 3 categories that we're going to look at. Various medications have benefits for that category, but there are also side effects to be considered and even risks, certainly when we get to category 3 with the stronger psychotropic drugs. So once again, when you do talk about psychotropic medications, you need to realize that there are 3 different categories of these medications, and you need to have a good working knowledge of each one's benefits, side effects, and risks. So let's talk a little bit then about these medications. Category 1 medications are used to treat things like minor depression, anxieties, and they include all the anti-anxiety agents, sedatives, and hypnotics or sleeping pills. Category 1 medications affect the limbic system and they produce a feeling of calm and sedation. So minor depression and issues related to sleeping or anxiety, and they want to produce calm, sedation, sleep, things like this. So that's the category 1, fairly minor, and yet there are benefits, side effects, and risks with each one. Category 2 treat major depressive disorders, and they include all the standard antidepressants. Under these categories in category 2, they include all the tricyclic and tetracyclic medications, the monoamine oxidase inhibitors, and stimulants. When we talk about treating severe depression, sometimes stimulants can be very useful in that regard. So category 2, major depression, the tricyclic, tetracyclic, monoamine oxidase inhibitors, things like this. Now when we get to category 3, this is where the real heavy-duty neurological and psychological issues are located. Category 3 treats major mental illness, things like schizophrenia and other psychoses. So in these medications, we're talking antipsychotics, anti-manic medications. If a patient is saying that they're having difficulties with hallucinations, delusions, peculiar behaviors, these sorts of things are treated by this category, category 3 drugs. They're the antipsychotics, the neuroleptics, the lithium carbonates, and there are 5 families of antipsychotics. The phenothiazines, the thioxanthines, the butyrophenones, the indolines, and the dibenzazepines are the main families within category 3 psychotropic medications. You need to be thoroughly versed in all these categories, knowing who's in what category based on what they're complaining of. Category 1 being the lightest, those having minor depression, sleep disorders, anxiety issues. Category 2, major depression, and category 3, true major mental illness here, the hallucinations, delusions, and very odd behavior. Be well versed in not only what system they affect, limbic system, things like this, but also the benefits, side effects, and risks.